Thank you very much for inviting me to be with you this morning, and I'm very privileged to have this opportunity to share with you some glimpses of Myanmar's experience along with the momentous change in Southeast Asia. Firstly, before my presentation, I need to express my sincere gratitude to everyone who has been fighting and combating HIV/AIDS in Myanmar over the last 2 decades. And without your contribution, through your conversation with me, this morning talk will not happen. So thank you very much for this, for your kind contribution and joining with us. And I will be standing here to present on behalf of everyone in Myanmar. And we have a very vast sort of networking in Myanmar in combating HIV/AIDS. Now, Myanmar is in hard transition, and you all might have aware Myanmar is embarking upon the accelerated curve of development, and our government is committed to increase access to health care and to improve the quality of services. As being in our transition towards a democratic society, we believe that it is necessary to speed up the momentum in the health sector in tandem with the rapid acceleration in political, economic, and executive reforms. While non-communicable diseases are in their rise in Myanmar, we still have communicable diseases still on priority, including HIV/AIDS as being a national cause since the very beginning. So HIV Sentinel surveillance has been started since 1992, covering subpopulation target groups such as pregnant mothers, new military recruits, blood donors, female sex workers, men who have sex with men, people who inject drugs, and male STI patients. When we look at the prevalence of the Sentinel population groups 1992 through 2012, for 2 decades, it is noted that most of the trends are found to be declining, but still relatively high among key affected population, including female sex workers, MSMs, and IDUs. So the momentum of the prevention activities, it truly needs to be maintained and even then to be strengthened. As the Asian epidemiological model has supported the data from 2013 as 0.47% HIV prevalence in adult 15 above. And then it was found to be declining from the 0.94% in 2000, but we still have an estimated number of people living with HIV/AIDS, both adults and children, over 190,000. An estimated number of AIDS-related deaths, it's over 14,000. An estimated number of new HIV infections, it's around 7,000. An estimated number of ART needed, as you have to delete the last digit number because it is a typing error, it is over 120,000. And then trends of HIV prevalence among low-risk Sentinel populations. So we have pregnant mothers. They are in low risk, but in a way they are the very significant and important component of our subpopulation. And blood donors and militaries, they have their prevalence of 0.6%, 0.2%, and 1.8% respectively. Trends of HIV prevalence among most at-risk population. This is still very alarming situation, like a male STI patient and injecting drug users, female sex workers, and MSMs. The percentage as we have as of 2013 that you will see on the graph. Myanmar is now in the stage of the concentrated HIV epidemic, with HIV transmission primarily occurring among key affected populations. And then trends of HIV prevalence among key populations aged 15 to 24, it is on the declining. Let me move on to since the outset, we have a very strong national response to HIV/AIDS. One of the priority diseases, it has been included in the National Health Plan in their series in Myanmar, and disease of the national concern since 1989. A National AIDS Committee was established in 1989 under the National Health Committee, which served as a multi-sectoral body for formulation of national strategic plan to prevent, control HIV and AIDS in Myanmar. Myanmar is currently responding to according to the National Strategic Plan and its operation plans. Now we are in the stage of the second National Strategic Plan in Myanmar. It has been developed in 2010 with the participation of the multi-stakeholders, with all development partners. We used to have a progress report with the implementation of the plan on a yearly basis, but it is much more room to get it improved of our fighting with the HIV/AIDS in Myanmar. Let me move on to the very important message of our existing country context, Myanmar's transition in health. This is, in the past, we have violence, we have displacement, end up with a poor health outcome and disrupted service delivery due to conflicts. Now we are in the present situation, and the present period is we are trying to move into the era of the national reconciliation, but at the same time, we have a much progress in making peace. At the same time, we have to remind ourselves that there is a fragmentation in the service delivery. And in future, we are looking forward for having a full-fledged peace and then bringing the equitable health system. And at the same time, we have sanctions with our dictatorship administration in the past. And then, as usual, it is once we have a very strong public health system, and then it became into a weak infrastructure, and then we are facing, in the past until now, with the human resources for health crisis. But in the meanwhile, at the present moment, that we have the parallel aid flow and then increased spending, but we still need to strengthen our management and leadership and governance. And then, but we are very promising, and then we are optimistic to have a democratic society with the bottoms of accountability by every single citizen in our country, and then through the sharing of the greater access of all the information to everyone. Previously, experiencing from the closed economy and the closed system, there is the very serious limitation for the involvement and the participation of the formal private sector. But now we are open up, and then so we welcome everyone with main focus on the private sector, civil society. So at this stage, at the moment, we have faced with a limited capacity to design and manage public-private partnerships versus growing private sector role. But again, we are optimistic to have the open economy with improved government's stewardship and oversight role, the private sector contribution towards improved health outcomes. When we look into our health sector, it has been provided urban and rural settings, our health services were a mix of the private, public, and as well as the traditional medicine. And then the most striking information is Myanmar investment on the health as percentage of GDP, previously 0.9% in 2010, and it has been increased to 1.8% in 2012, still well below the target of 5% minimum, though we have targeted in 2014, but we aim to increase 4.88% of GDP through the implementation of the universal health coverage. And high rates of preventable deaths, including HIV/AIDS, it's still one of the top 3 causes of death. And new health policies are leading towards having the transformation and the Myanmar health sector reform. And the universal health coverage in 2030, that is our vision 2030, since that time, we have intended to go through improving health outcomes, enhancing financial protection, and ensuring customer satisfaction. With the evolving government priorities for HIV, It has been decentralized services nationwide, including in remote areas for the HIV counseling and testing and ART treatment, to reduce barriers for individuals seeking HIV testing and reduce treatment delays. Previously, we have lack of investment, lack of funding, and then so we never have had a sufficient supply for the ARTs. But now we have another barrier. Now we are receiving more funding and we are receiving more drug supply, and then we can say we are going to have a sufficient, but now we are concerned about how can we get access to the all positive people. So further HIV prevention effort needs to be made among people who inject drugs and then MSM. So government contribution for HIV prevention care and treatment was significantly increased. Both immediate and long-term strategic planning is underway to efficiently use current HIV funding and gain additional funding. So at that point, coordination is the most important issue among all of us in all constituency, and then every single person or individual has a role to play. With the increasing funding receiving outside of the country and as well as from the government, we have come up with more opportunity to engage with the community. And even in our universal health coverage package, and community engagement is a must and an essential. Without the community participation and involvement, we cannot go through very smoothly to reach our goals. And partnership with the external partners, over $800 million has been pledged for the health sector from the external funding sources within the period of 2008 to 2019. And however, currently main external funding source for HIV portion is from Global Fund. So while we are receiving the increasing budget from the public expenditure, the share from the government, now we are in the stage of to pledge to take more share from the public funding as well. With the easing of the sanctions, international actors are scaling up programs and more resources have become available, though HIV resources are still limited. So despite the challenges of our Myanmar health system, government and our international partners are very optimistic that we can make it happen. So coordination is the most important piece in the forthcoming system, and then we have a Myanmar Health System Coordination Committee chaired by Union Minister of Health. This is the very meaningful platform that everyone can come up on board, and then that we can play our role. This is just a very brief information about donor support to the health sector. Various donor support with their health system strengthening focus areas. The financial gap still exists and we need to be strategic. We have outstanding challenges, that is creating a better enabling environment, and we need to ensure adequate human resources, and then how can we make use of the best in the most efficient way of the existing health workforce. And then we need to improve the key laboratory services and supply chain management, and then it is really need to have access to the hard-to-reach areas of the country, given that Myanmar has very diverse geographical terrains. And then financial investments necessary to fill the remaining resource gap and meet the needs and commitments of programs set to reach more people with the life-saving HIV prevention and treatment. This is the way forward, and investment in and strengthening of the health sector is urgently needed to fulfill Myanmar's commitment to the MDGs. And accountability and good governance needs to be promoted, as now we are being in our third wave of the new administration. And coordination within the health sector should be upheld to avoid fragmentation or overlapping. This is calling for everyone to join our hands and then work, and then we all can make it happen if we work together. And then thirdly, to ensure support for the government's strategic directions towards universal health coverage, in which priority areas including HIV, TB, malaria, and maternal newborn child health it should be addressed under the essential package of services. And finally, post-2015, HIV and unfinished business of the MDGs must remain. The key messages that I would like to share with you in my conclusion are firstly, health is a bridge for peace. We need to extend our services to ensure universal access, especially to our ethnic brothers and sisters, underserved groups in the peri-urban and far-flung remote areas, both geographically and economically hard-to-reach segment of the population. Country is in its transition and health system is transforming. And believe me that everyone has a role, I may repeat. We have a role to play. We can make a difference if we work together. And thirdly, we need to learn from everyone, learn from each other, make a best fit in our own setting. And finally, we need to ensure that HIV and unfinished business of the MDGs must remain as priorities in the sustainable development goals in post-2015. With that, I would like to express my special thanks to Dr. Min Shui, the program manager of the National AIDS Program, who cannot join me this morning, and his team, and every single person in this room and outside the room. Thank you very much again for your kind contribution through your conversation with me to make this talk happen. Thank you very much.